Good day and welcome to the Editor's Podcast. This is Dr. Linda Snetselaar, Editor-in-Chief of the Journal of the Academy of Nutrition and Dietetics. And with me today, I have Dr. Jennifer Webb, who is an Associate Professor in the UNC Charlotte Health Psychology PhD program. Her manuscript is titled Body and Fitness Related Shame Helps Explain the Association Between Internalized Weight Bias and Orthorexia Symptoms Among North American Female Yoga Professionals. This particular article is a part of the Jan theme issue titled Expanding Critical Investigations of Weight Stigma and Eating Behaviors. And the guest editors for that theme issue are Drs. Nicole Kelly and Nicole Guiliani. Both are professors at the University of Oregon. Welcome, Dr. Webb.
Thank you so much. It's such a pleasure and delight to be here. And again, to be included, for our work to be included in this sort of wonderful collection of research articles.
Thank you. The topic that you wrote about in your article includes health professionals, specifically yoga professionals, and they may indeed interact with RDNs in my profession. And what you were looking at is how their work might influence students and clients' orientations toward eating and well-being. So, first question, what about this potential interaction among two different health professionals makes your research important?
I think one of the big pieces here that really motivated this work is in the last few years, there's been a growing appreciation and recognition of the multiple opportunities as well as pressures there are on yoga professionals. So they're really on the front line of not quite being at the same as sort of like a primary care physician, yet they're, particularly in the West with the growth of yoga, there's a lot more folks who are interfacing with them for health well-being. And what we've been learning, both through sort of anecdotal, like clinical cases, memoirs, and now research, is that this is also a space where embodiment is, very front and center. So we're thinking a little bit more about the risks not only of the yoga professionals in terms of how they might be oriented towards their own experience of living in their bodies, yet how that also could be transmitted to their students and clients. So thinking holistically about the yoga studio environment as really like a microcosm, we've been thinking more about how we can, as yoga researchers, try to think about ways of equipping or better equipping yoga professionals in the community to be able to both support their own well-being so that they can show up and be as effective as possible for their students and clients. And part of that is increasing their network of other wellness and health professionals, like mental health professionals, as well as registered dietitians and nutritionists, for example. And some of those also have a background in body image and eating disorder populations.
Thank you. What type of study design did you use to address your research question?
So this particular analysis was drawn from a larger cohort project that's entitled the Yoga Teacher and Therapist Lifestyle and Wellbeing Study. These data were collected back actually right before and during the height of the beginning of the COVID-19 pandemic, so back in 2019, 2020. And so we drew some analyses from this larger data set from more of a, cross-sectional correlational design. So this was one time point of data collection.
What did your study participants, and in this case, as you've mentioned, yoga professionals, identified as their usual eating patterns?
Well, that's a really, really great question. And although we didn't necessarily ask them that kind, phrased in that way, we did give them a list of different kinds of eating approaches that they could select from. And a significant minority, almost 40% of the sample, not surprisingly, did identify adhering to more of an exclusively vegetarian or vegan sort of nutritional approach. And again, this is not that surprising for folks who might be coming to yoga from more of an ethical stance on approaching nutrition. And so that was not that surprising. There was another minority of participants who did endorse more of a generic approach to clean eating. And so that kind of gets a little bit closer to one of the main variables that we were looking at in this study in terms of orthorexia.
What were specific outcome measures that you used in this study?
So in this particular study, the primary outcome measure was an indice of orthorexia symptoms. And what we've also been learning, it's a really exciting as well as challenging time in the research as well as I'm sure clinical practice in trying to pin down really what is orthorexia. And a lot of research has been coming out in the last several years. And although it's not clinically a diagnostic condition, according to, for example, the DSM, it'll be interesting once the DSM is updated once again, if the research that has accrued during the time period since the last publication of the DSM-5 might shed some light on the utility of it meeting some threshold of it becoming an official diagnosis. So what's also been really interesting that helps to kind of muddy some of the waters is that some research suggests that orthorexia is not necessarily all or nothing. So there's some folks who have understood and measured orthorexia in sort of these ideas of it being either more maladaptive or more adaptive. That's not the approach we took in our analysis. So the measure we used did typically sort of frame things in terms of more of a maladaptive orientation towards um, eating in a way that you are really prioritizing the quality and the framing of what you're eating as healthy, yet it could be at the detriment of other aspects of your well-being. So, for example, uh, endorsing attitudes that make it seem as if you're engaging in this approach to eating in a way that demonstrates that you're sort of superior, more kind of superior minded than other people. Or sort of there's like a little bit more of a moral quality to certain ways of understanding orthorexia. So we're kind of at this kind of hierarchical kind of approach. It's not just that I'm choosing to eat in a healthy manner, and I'm using air quotes, you can't see that because that's a whole other topic. What is really healthy eating? And yet, for some folks, it can start becoming much more aligned with in a kind of a disordered fashion. So they're, spending an inordinate amount of time consumed in terms of their thoughts around healthy eating, trying to procure healthy eating, trying to, it almost takes on qualities of kind of obsessive compulsive disorder features in the context of food and eating attitudes. So when things are getting to that point and when you might start having uh, uh, other consequences, maybe relationally. So, for example, you might, opt out of spending time with loved ones because you're not sure of the restaurant or if you'll have access to certain kinds of foods that, again, there could be some other interpersonal consequences in addition to the intrapersonal consequences of having more of this, what we're trying to understand, more maybe more of this more maladaptive variation of orthorexia. So that, in a somewhat of a nutshell, is sort of giving a little bit of a context around the construct of orthorexia. And in our study, we were treating it more in a maladaptive way, although in the broader research literature, there are folks who are studying it in a little bit more, at least sort of bidimensional way.
Thank you so much. I think in the profession, of RDNs, there is much more of a focus on orthorexia. And so your way
Mm.
of looking at that from a variety of angles, I think is so important. And I'm so glad you're doing research in that area. If you were to think about three major messages that a reader might take away from your article, what might they be?
Wow. Uh, I think first and foremost, it's hopefully having compassion for yoga professionals, that they're human as well, and they're susceptible to the same kinds of messages from diet culture that all of us are and have gotten exposed to over the years. So I think that's really one of the big takeaways I hope that readers will glean from our work. Because some of the research that had already been conducted in this space had not really clarified whether or not the yoga practitioner was also a teacher or therapist, sort of in a little bit more of that authoritative role, so that they're, have this opportunity to sort of share their messaging, whether implicit or explicitly, with their students and with their clients. So I think that's one of the big takeaways, is that yoga professionals are human as well. They're also susceptible to diet cultural messages, including those related to internalized weight bias and those related to, relating to one's body with shame and guilt, for example. I would say another maybe key message is that this idea of role modeling positive body image is a really intriguing one that deserves a lot more empirical attention, and one that hopefully can be better translated into practice in terms of as it relates to the variety of disciplines that sort of might have a stake in better understanding how, as a health professional, how you are oriented towards your own experiences of eating, body image, embodiment, again, may be transmitted, maybe unintentionally, to your clients, to other folks that are vulnerable. And so, this idea of role modeling body image, at least the measure that we used in our study that we adapted for this particular professional population, was originally developed to better understand how maternal caregivers of young children role model elements of positive body image to their children. And so we definitely saw some really nice opportunities to apply the same kind of idea in the context of the yoga sort of community. Yet it can be applied in a lot of different professions, like, for example, among RDNs, I would imagine. So that's maybe a second takeaway. It would be really wonderful to just learn more about um, how we can better measure role modeling, positive body image across different disciplines, and so that it can be applied more broadly and hopefully can lead to better and more effective ways of engaging with clients and students across various allied professions. And then I think the third piece I'm hoping folks might take away is to really stimulate this interprofessional collaboration. So as I sort of started out with is, I'll kind of come back to that I'm really hoping that this can help stimulate some more opportunities for yoga professionals, um, registered dietitians, nutritionists, mental health professionals, who all have a stake in trying to reduce disordered eating, negative body image, and promoting well-being among folks who are, for example, engaging in yoga. And again, it's just been growing exponentially in the West, yoga practitioners. So I just think this is a really wonderful opportunity to encourage more of that collaboration.
Thank you so much. The idea of role modeling, you're right, is something that applies to many health professionals. So, super important concept. And I think your article very much brings up concepts that apply to many different health professionals, particularly in the area of stigmas. So, thank you. Thank you for that work. And then finally, how might a practicing RDN use your research in terms of working with clients?
Again, a wonderful consideration in thinking about more of that applied piece. And again, I would probably say if they're not already attuned, and you did mention that orthorexia is even more, there's more awareness within the discipline to continue to and maybe encourage that awareness and assessment with clients and trying to better understand sort of where our clients that they're working with in this sort of continuum of orientation towards healthy eating. Because again, that may or may not uh, be something that the individual is forthcoming about in consulting with a dietitian. And we've noticed some of the research does suggest that since COVID-19 in particular, obviously this orientation towards eating it was not new, yet there's been an increase. Some data does suggest increase in orthorexia symptoms since COVID, which also sort of makes sense if folks are sort of seeing food and kind of quote unquote sort of healthy eating as maybe a way to improve their immunity to hopefully not contract COVID or to prevent COVID, that does make a lot of sense. So again, I would just encourage folks to continue to prioritize, checking in about orthorexia related symptoms and also trying to better maybe understand maybe there are links to that sort of diet cultural kind of mindset that again does tend to demonize individuals in larger bodies and tries to elevate folks in smaller bodies.
Thank you so very much, both for your clarity on this topic. And my hope is that many of our professionals who are a part of the JAND readership will go to this particular podcast to learn more about your insights related to orthorexia as one of the concepts, but also just I think the importance of being able to look at a variety of health professionals and how they respond to the whole concept of stigma, I think is incredibly important. So thank you so much, and I appreciate your time and the work that you did on publishing this article. Thank you.
Oh, thank you so much. It's been an honor and a privilege.
Thank you for listening to our discussion today. Additional scholarly articles related to today's topic are available on our website at www.jandonline.org. If you found this discussion informative, please like the video and subscribe to Jan's YouTube channel for more content. Thank you for your time and support.